Hi everyone, welcome to Szenan-Balance vlog. This is Szenan-Balance from Szenan-Balance, the acupuncturist. Today I'm going to show you a quick way to relieve pain in the hand. Right. So last week I have a real case. This patient came for shoulder pain. So after treatment of shoulder pain with acupuncture, and then he told me that he actually had an injury on palm over here, pains on the fourth metacarpal bone and the fifth metacarpal bone, which is over here and here, and that's for I think for about 6 months. All right, and that is critical to get it fixed now, because it's been for 6 months, it hasn't been healing properly. As soon as we squeeze his hand, all right, as ask him, what is, you don't feel pain right now, but when or where, how did you feel the pain? If you shake hand, right, feel the pain, or he squeezes his hand, it's painful, and when he work, that's painful, and that pain is in here. Now I didn't do any needle for this case. I only go to the opposite side and do some acupressure point. So it's very simple. I went, because the pain was here, right, and I went to the opposite side and did it over here. So just gentle and get the point and massage there and find the point, sensitive point, and work on that. So pretty much you see pain over here, good, massage over here. It's very simple. It's totally simple. Now apart from there, so I asked him to do it every day, at least once a day, and to help with this one. So you see, it's quite different. We don't actually put needle in here or massage in here, but can you do it on here? Yes, you can. This is the local acupuncture, local point acupuncture. This is distal point acupuncture strategy, right? So I use the distal point. Instead of needle, I use acupressure point and just gentle massage, and it will also give you immediate relief. So this is something that I want to share with you today. Now, if you suffer from any pain over here, then you do it on the opposite side. But hey, if you're an acupuncturist, I want to tell you this. I'm going to let you know. Now, we focus on treating meridian, right? But you will find on the hand, there is sometimes there is no meridian like this. There is no meridian go past over here. So where do we treat? Which meridian do we treat? If you're not using local point, you use distal point. We use image. You see, in this case, don't focus on meridian. Just focus on the image. The image balance it. So apart from here, this hand can treat that hand. You can focus on foot, all those feet, toes. It's similar at your hand. You can focus on here to treat that. That's how we choose the point. And apart from that, what if I have patient come in, they don't, for some reason you can't put needle in here, or they don't have legs for you to put needle, and they got I have patient who have broken arm on that side, and they cover all up. I have patient lost their fingers, and for some reason you just can't access to the opposite side, What can you do then? Well, you can use scalp acupuncture. Over here's hand over here. There's some point over there can treat fingers very, very well, can treat hand very, very well. Okay, through scalp acupuncture, tan scalp acupuncture. So all this thing, if you learn all this distal acupuncture technique, how to use image to target here, and you never run out of points. So if you're an acupuncturist, I want to let you know this, that in next month coming up in March, for the 26th to 28th, 3 days, I'm going to do a 3 days live webinar that I'm going to teach you all this thing. Right? If you're interested in it, please, up there or down there, there's a link. Click it down and read through everything and subscribe to my 3 days live webinar. I'll see you next time. Bye bye.